All right, now, for 50 years, Priska Akama has never drunk water or any form of liquid freely. This was after she was diagnosed with vescovaginal fistula, a condition that deterred her from controlling her bladder. Fred Muturi gives us the story of the widow who lost 4 of her babies after developing the condition, but survived 50 years on to undergo a successful repair at the Kisii Teaching and Referral Hospital.
The 78-year-old woman developed the condition due to a prolonged labor, and for the past 50 years, she underwent humiliation and stigma since she was deemed a social misfit.
Watu wakiniona kanisa wanaeva. Naenda mahali fulani, nyumba ya fulani, mwenyewe aoni mzuri kweli. Anasema huyu anakuja kufanya nini hapa? Sangine haribu geti yangu, geti ya kukaa. Hitu kinamwageka pa. Anamwageka yenyewe.
She joins other women suffering from vescovaginal fistula and rectovaginal fistula, undergoing free repairs at the hospital in a program that is being sponsored by the Flying Doctors Society of Africa and the Freedom for Fistula Foundation. When her baby got trapped in the birth canal for 5 days, she sought the services of a traditional birth attendant. She got her abdominal palpation checked and the baby was forcefully pulled out. She collapsed only to wake up in an hospital bed. She recalls how painful the process was.
Nakuwa nusuni sana. Saa ile watoto wanakuwa wananiguacha tena na mimi ninagonjeka. Sasa nani atanisaidia?
The biggest problem we have is how to prevent the fistulas from forming. And we know in Kenya that over 1,000 new fistulas are being formed every year, and the capacity to handle this number is limited. But however, with the government support, with the participation of our partners, the Freedom from Fistula Foundation, our partners, the Flying Doctor Society, we train the surgeons, we train the nurses so that these fistulas can be encountered much earlier, prepared so that the women don't have to go through stigma.
Nakuja hapa Jumamosi. Naona wamama wengine wanaanza kueva. Ngabauliza nini mbaya? Nani ataenda kutuangalia? Umwangalia nini kama unateseka unabicha? Basi kubicha daktari.
Another patient is a 12-year-old girl who dropped out of school due to stigma related to the condition. She developed the condition after birth and her parents ran away from her. Jane Nyaboke now lives with a Good Samaritan and hopes that she may go back to school after the repair.
The thing is, once fistula has occurred, management should start immediately.
It was noted that some of the mothers screened were underage girls, including the elderly, and had suffered for several years now while their families broke up because the community lost hope on them.
If the patients or the clients can arrive early enough in labor and they are monitored properly while in the hospital, then fistula is preventable. Yeah, unfortunately, many of them may come late, and by the time they arrive at the hospital, damage has already happened.
Dr. Wakasiaka also said that the country records at least 1,000 new fistula cases every year. The program targeted 80 women for repair, and so far 40 have gone through screening, and 35 of them have undergone a successful repair. Doctors are asking women to seek for medical care early enough during labor so that they can also be saved from cancer associated to fistula. Fred Muturi, KTN News.